Hey guys, Dr. Natty here from Myokinetic Physical Therapy and Performance, and today I want to talk to you guys about best things you can do before your orthopedic surgery. This includes your ACL, your UCL, your knee replacement, and your meniscal repair. So all of those surgeries. Number one that I want to talk to you guys about is setting up your routine for success. Right after you come out of your surgery, you know you're not going to feel the best. You're going to be in a lot of pain. So what I like to tell my patient before they go in is say, hey, listen, here's what your surgery is going to look like. If you are going to get your shoulder surgery, you know you're going to be in a sling for the next 2 weeks. So why don't you start sleeping in a recliner so you know what it's like to fall asleep in a recliner. Set your bedroom in a position that you know you need to sleep in, right? If you know you're going to be getting your knee surgery, your ACL, you know you have to sleep in a knee brace. So what that means is that get comfortable in sleeping facing up, making sure that your pillow is propped underneath your heel so you know what it feels like to sleep in that position. Number two, you want to have accessibility to every single thing inside your house. So all the things that you use the most, especially when you have to go to the bathroom, you have to brush your teeth, make sure you set everything up. Have like a little care station where you can actually access every single thing that actually put you in a safe manner. So you're not reaching, grabbing, and you're not out of balance, because some of you guys might be taking some medication and those medications might make you a little bit sleepy and groggy. So we don't want any risk of you falling, right? Number three, you want to have all your nutrition stuff planned in advance. What I mean by that is that you want to have all the things that stock up that you know you can eat. So for me, I always recommend bone broth because it has a lot of vitamins, a lot of proteins, and you need protein in order to heal and recover, right? I would also have water ready to stock up, ready to go. All the little snacks that you know you can have without upsetting your stomach, right? These are little things that you want. And again, I always have comfort food because I know when I'm in pain, I just want to eat the things that I like and I enjoy. So you can have a little bit of that. Another big thing as well is that when I try to talk to all my athletes, all my patients before they get surgery, is that you want to plan in advance of how much you're going to eat, because you're going to be so inactive and you're going to be fatigued and you're not going to move as much. So what we don't want is unintentional weight gain. So making sure you plan your meals in advance and know how you're going to sleep, the best position to sleep, that will help you a lot. Lastly, the most important thing, as you're following me so far, is to make sure you go get PT before your surgery. So there's so many research done right now that's showing that if you come to do your rehab, right, or your prehab before your surgery, your recovery is actually a lot faster. Here's what's going to happen, right? If you were a patient, you come into me, I would say, hey, here's what you can expect post-surgery. Here's are some exercises that you have to do at home. Here's what they should feel like. Here's how you can do them correctly. So that way you go in with a game plan in your head already, so nothing is catch by surprise for you at all. And this is the last thing I want to leave you guys with, and it's so important. It's a huge game changer for us, is we encourage all of our patients to keep a diary, a notebook, so they can document exactly their progress of what they're going through, the pain level, what's the struggle, what's the win. So that way when you come back in for rehab, you can talk to the therapist exactly what you're dealing with. And the biggest thing for me when it comes to journaling is journaling small wins. We want to make sure that you keep journaling those small wins so that way you have good positive momentum. And there's so many research show that if you go and you measure yourself backwards of all the win that you actually have a positive emotion towards your recovery. Especially if you have a long recovery like an ACL, which could take up to a year, you need those positive reinforcement every now and then. So getting a journal, that would be a huge help. So I hope you guys enjoyed this video. If you do, please like and subscribe, and I'll see you next time.